Hello health enthusiasts, let's talk about something that affects millions of people's stomach problems. Specifically, we're diving into Irritable Bowel Syndrome, or IBS. Are you constantly battling stomach issues and wondering if it's more than just IBS? Stay tuned as we uncover 9 signs that your stomach problems might be something else entirely. If you're experiencing persistent stomach problems, it's crucial to consult with a healthcare professional for proper diagnosis and treatment. Dealing with stomach pain and think it could be IBS. IBS pain is often relieved by going to the bathroom. Have you noticed a pattern? Does the pain lessen after a bowel movement? Persistent pain after bathroom trips needs attention. It could signal something else. Pain that disrupts your life might indicate other conditions. Persistent pain could be a symptom of Crohn's disease or ulcerative colitis. If typical IBS remedies don't help, talk to your doctor. Don't ignore persistent pain, it's your body's way of telling you something's up. Let's talk about something that can be a little alarming. Blood in your stool. Blood in your stool is never normal and it's always a reason to see your doctor. While small amounts of bright red blood could be due to hemorrhoids, it's essential not to self-diagnose. Blood in your stool could also be a sign of something more serious, such as diverticulitis, polyps, or even colorectal cancer. The color of the blood can provide clues about the source of the bleeding. Bright red blood usually indicates a problem in the lower digestive tract, while dark, tarry stools could suggest bleeding in the upper digestive tract. If you notice blood in your stool, whether it's bright red, dark, or you're unsure, don't wait. Make an appointment with your doctor as soon as possible. Early detection is key when it comes to digestive health. It's tempting to celebrate when the numbers on the scale go down, but unexplained weight loss is never a good thing. If you're losing weight without making any significant changes to your diet or exercise routine, it's essential to take it seriously and talk to your doctor. While IBS can sometimes cause minor weight changes, significant and unintentional weight loss could be a red flag for a more serious underlying condition. Conditions like celiac disease, Crohn's disease, ulcerative colitis, or even certain types of cancer can affect your body's ability to absorb nutrients effectively. If you're experiencing unexplained weight loss along with other digestive symptoms, it's crucial to get checked out. Early detection is key when it comes to many health conditions, and addressing the underlying cause of the weight loss is essential for your overall health and well-being. We all know that family history can play a role in our health, and our digestive health is no exception. If you have a family history of certain gastrointestinal conditions, you might be at an increased risk of developing them yourself. Talk to your family members and see if there's a history of IBS, inflammatory bowel disease, IBD, celiac disease, or colon cancer in your family. These conditions can have a genetic component, meaning they can be passed down through families. While having a family history of a certain condition doesn't necessarily mean you'll develop it, it does increase your risk. Being aware of your family history allows you to take proactive steps with your health. If you know you have a family history of digestive issues, you can discuss it with your doctor. They might recommend earlier or more frequent screenings depending on your individual risk factors. We've all experienced an upset stomach or a bout of food poisoning that left us feeling nauseous and, you guessed it, vomiting. However, severe or persistent vomiting is a different story. If you can't keep any fluids down or it lasts more than a day or two, seek medical attention. Severe vomiting can lead to dehydration and malnutrition, which can have serious consequences. It could be a sign of a blockage, infection, or pancreatitis. Don't hesitate to reach out to your doctor. They can determine the cause and provide treatment. Remember, your health is a priority. Our bodies are incredible machines, and fever is one of the ways our immune system fights off infections. When it comes to stomach issues, fever can be a sign that something more serious is going on. While IBS itself doesn't typically cause fever, other conditions that can mimic IBS symptoms, such as inflammatory bowel disease, IBD, diverticulitis or appendicitis, can cause your body temperature to rise. A fever, especially when accompanied by other symptoms like severe abdominal pain, chills, or bloody diarrhea, is your body's way of signaling that it needs help. If you have a fever along with persistent stomach issues, it's essential to contact your doctor or seek medical care. They can evaluate your symptoms, determine the underlying cause of the fever, and provide the appropriate treatment. A fever is a sign that your body is fighting something, and it's crucial to address the root cause to prevent further complications. Eating should be an enjoyable experience, but when you have difficulty swallowing, it can be concerning and even a little scary. If you're experiencing pain, pressure, or a feeling of food getting stuck in your throat or chest when you swallow, it's important not to ignore it. This is known as dysphagia, and while it can be caused by various factors, including muscle disorders, nerve damage, or even anxiety, it can also be a sign of a digestive issue that requires attention. Conditions like gastroesophageal reflux disease or GERD, esophageal spasms, or even esophageal cancer can cause difficulty swallowing. If you're experiencing difficulty swallowing, your doctor might recommend a barium swallow test or an endoscopy to get a closer look at your esophagus and determine the underlying cause. Early detection and treatment are key to managing dysphagia effectively. We've all had those days when our stomachs aren't feeling their best, and diarrhea might be the culprit. But what happens when diarrhea becomes a regular occurrence? If you're experiencing persistent diarrhea that lasts for more than a few days or is accompanied by other concerning symptoms, it's crucial to seek medical attention. While IBS can cause diarrhea, it's usually manageable with dietary changes and stress management techniques. Persistent diarrhea, on the other hand, could indicate a more serious underlying condition. Conditions like Crohn's disease, ulcerative colitis, celiac disease, or even infections can cause chronic diarrhea. If you're struggling with ongoing diarrhea, your doctor can help determine the underlying cause and recommend the appropriate treatment plan. Managing diarrhea effectively can significantly improve your quality of life. Feeling tired all the time? You're not alone. Fatigue is a common complaint, but when it's persistent and accompanied by other symptoms like pale skin, shortness of breath, or dizziness, it could be a sign of anemia. Anemia is a condition where your body doesn't have enough healthy red blood cells to carry oxygen to your tissues, and it can be linked to certain stomach conditions. Conditions that cause chronic bleeding in the digestive tract, such as ulcers, Crohn's disease, or colon cancer, can lead to iron deficiency anemia. If you're experiencing persistent fatigue and suspect anemia, it's important to get tested. Your doctor can check your blood iron levels and determine the underlying cause of the anemia. Treating the underlying condition is crucial for improving your energy levels and overall health. So, there you have it. 9 signs that your stomach issues might be something more than just IBS. Remember, your gut health is incredibly important, and it's crucial to listen to your body and seek medical attention when something feels off. Thanks for watching. If you found this video helpful, please give it a thumbs up, share it with your friends, and don't forget to subscribe to our channel for more informative content. See you next time. And as always, if you're experiencing persistent or concerning symptoms, don't hesitate to reach out to your doctor or a qualified healthcare professional. Take care of yourselves, and I'll see you in the next video.